Rep. Aderemi Oseni, representing Ibarapa East Federal Constituency, has called on Nigerians to support government initiatives and stakeholders in building a healthier, stronger, and more compassionate society. He made the call during the flag-off of a free 1,000 breast cancer screening program organized by Access to Basic Medical Care Foundation in Ibadan, aimed at raising awareness about breast cancer in commemoration of Pink Month, themed Closing the Gap in Cancer Detection. According to him, breast cancer remains the leading cause of cancer-related deaths among women in Nigeria, with about 28,000 new cases annually, noting that low awareness levels and limited access to early screening contributes to slow progress in the fight against the disease.
In Oyo State, as in many parts of the country and Nigeria in particular, awareness level remain low and access to early screening is painfully limited. That is why this campaign remains an important message to every one of us that is seated here today. I have championed several healthcare related issues for all. Only this past June 2025, I moved a motion on the floor of the National Assembly calling for the federal government to subsidize dialysis, treatment, and all cancer-related matters. To the glory of God, by the singular support of our father, the President of the Federal Republic of Nigeria, the motion was not only passed. I want to sincerely inform everyone here today that today dialysis is either free or fighting. There is something that is being fought on a daily basis by the federal government of Nigeria. I have facilitated the establishment of modern hospitals in Ibarapa East Federal Constituency. Some of these hospitals are specifically called specialist hospital, where specific cases like this will be treated. Let us be clear on this. This is not a tax for one person. So I want to encourage every one of us, including all government agencies in our environment and in this nation, to equally support this goal.
Wife of Ogun State Governor, Mrs. Bamidele Dapo-Abiodun, praised the program for aligning with global best practices, adding that it will benefit people beyond Oyo State, and commended the founder, Mrs. Florence Ajimobi, for her dedication to humanitarian work, particularly in supporting the less privileged.
This initiative saves women from late-stage diagnosis. It will also ease the financial burden on families, particularly those already struggling. We know that cancer affects not only the patient, but the entire family, emotionally and economically. The presence of ABC Foundation in Oyo State has truly made a difference. It's not only touching lives locally, but is influencing national health advocacy and policy.
The founder of the foundation, Mrs. Florence Ajimobi, wife of former governor of Oyo State, said that the organization has provided relief and medical care to people for 13 years, however pledged her renewed commitment to fight breast cancer after losing her daughter to the disease.
Earlier this year, to be precise, on the 27th of March, I lost my beloved first daughter, Abisola, to breast cancer. That painful experience has strengthened my resolve that no other family should have to go through such a loss when awareness, early detection, and timely care can make all the difference. I renew my commitments to fight with even greater passion, to save more lives, and to ensure that our women are protected, our families preserved, and our communities strengthened. To fight against breast cancer, let us keep hope, one woman at a time, until the day breast cancer is no longer a death sentence in Nigeria.
Dr. Bolaji Ayandipo of the University College Hospital emphasized the need for national guidelines for breast cancer screening, community-based interventions, and public awareness campaigns.
Community-based intervention, like has been alluded to already, we shouldn't look to the urban areas alone. The rural area is very deserving of our attention. We need to train community health workers, and outreaches in the rural and undeserved areas should be done. Public awareness campaigns should be very, very highlighted. The consequences of late-stage detection is that the disease is aggressive and is costly to treat. We then have lower survival rates. Prevention is still the most best method to approach it.